Welcome back to the Ed Show, coming to you live from the free healthcare clinic here in Hartford, Connecticut. I want to bring in the medical director for the clinic, Dr. Bruce Gould, who is the medical director for the Hartford Department of Health and Human Services. He is the associate dean for primary care at the University of Connecticut Medical School. Dr. Gould, great to have you with us tonight, thank you for what you're doing. Why are you here?
Well, my day job is running a clinic in Hartford in the North End for both the university and St. Francis Hospital, and day to day I see the carnage of a broken healthcare system. The healthcare system, I think most doctors agree the healthcare system just isn't working for a lot of their patients, and if you're uninsured, you don't have access to anything.
What's the common denominator here with the people that you saw today and have seen at other free clinics?
They've lost their job, they've come on hard times, some of them are just ill, pre-existing conditions, all sorts of reasons why they're uninsured. They're working, they're just trying to make their lives better, and yet they really have no access at all to any health care. Some of them have preventable diseases, hypertension, things that we can treat, and yet I've sent several people to the emergency room today with uncontrolled hypertension.
Where do you think most providers are in this country when it comes to reform? Do you understand what's going on in Washington?
I think most doctors, and I think polls have supported this, that most doctors are in favor of broad health care reform, really retooling the whole system, because those of us that are in the trenches realize that it's just not working.
Do you think that this clinic has a profound effect on people that come in and see what's actually going on?
You know, I think that it just tells us. You know, today I have actually a patient waiting for me from Woodstock, New York, who came all the way from New York State to get health care. You know, how sad is that in a country as wealthy as the United States, and we still are a wealthy country, that we somehow have lost the caring for our neighbors that we, I think, once had.
Do we have a shortage of doctors in this country, if everybody were to be covered?
I think if everyone were to be covered, and looking at both the retirement rates of existing doctors and the aging of our population, I think we need more doctors across the board as well as other providers. And we also need a redistribution of those doctors into primary care and generalism.
Dr. Gould, thanks for joining us tonight. Appreciate your time.
Pleasure.